Hello and welcome to Mississippi Insight. I'm Byron Brown. Thank you for joining us. This morning, we are rewinding the tape on the road to normal, a Mississippi town hall. Governor Tate Reeves, Dr. Thomas Dobbs from the State Health Department, and MEMA Director Stephen McCraney joined us for an hour-long discussion about the COVID-19 pandemic 1 year in. We want to highlight some of our panel's responses to viewers' questions, especially from a policy perspective. Joining me now with his thoughts on the town hall is Adam Ganucheau. Adam is the editor-in-chief with our reporting partners at MississippiToday.org. He and his team continue their extensive reporting on the state's response to this pandemic, and we're glad to get his analysis this morning. Adam, welcome back to Mississippi Insight.
Thanks for having me, Byron. It's always a pleasure.
Adam, first off, what is your general takeaway from Tuesday night's town hall?
Yeah, first off, I'd say congratulations to y'all for getting the governor and Dr. Dobbs in one place. We haven't seen that in a little while, at least. In all seriousness, the governor has been a little bit more absent with media and press and sort of public availability in this way. So I'd say kudos to y'all for landing the good interviews, but kudos to the governor for making himself available in this kind of forum. Generally speaking, I thought that it was a lot of the same that we have seen from both the governor and Dr. Dobbs. As I watched it, as I think about sort of what we heard from them and how the dynamics played out, I mean, it's a lot of the same. Like I said, I'd say there's some inconsistency in some of the governor's messaging, and there's certainly some clashing between some of the advice and sort of counsel that we've heard all along from Dr. Dobbs, of course, the state's top medical expert, about the pandemic and about certainly, precautions that have been taken along the way, in addition to vaccine rollout in the last few weeks.
A lot of the focus was on vaccination efforts, and just as your team at Mississippi Today did, we examined how the state has been doing in terms of vaccinations per capita. Take a listen. We found that just about 577,000 Mississippians have been fully vaccinated, not counting those vaccinated by federal agencies. That number is less than 20% of the state's population of 2.9 million. By that measure, we rank 45th out of 50 states in vaccinations per capita. Governor, is that an acceptable performance level of vaccination efforts?
Well, what I would tell you is that something that you said that I think is very important, Byron, is not including those Mississippians vaccinated by federal agencies. I think if you're going to look at total vaccinations, you ought to look at total vaccinations. And so far in Mississippi, we've fully vaccinated about 635,000 Mississippians. The other thing I would tell you is when you look at the vaccine hesitancy, that's certainly something that we're beginning to experience more and more of. We went literally until basically the end of March where supply was far below demand. Well, now we find ourselves in a position where demand, or at least supply, has caught up with demand and maybe even surpassed it to a certain extent. One of the things Mississippi's done exceptionally well is ensured that we had an equitable distribution and equitable access to the vaccine across geographic regions, across races, across the board. And the fact is that when you focus a little bit of time on that, it takes away a little bit of time from an efficiency standpoint. It's just a natural progress.
So, Adam, what did you think of Governor Reeves' response there?
Yeah, so again, this is sort of just the journalistic perspective on this, sort of having covered the governor and his actions and words and, policies over the last, year plus now since the pandemic began. Thinking about sort of why we lag behind other states. I'm thinking back to several times in which the governor himself, didn't issue strict enough sort of orders, and it's hard to say whether they were strict enough or not, I guess. But you do think a lot about, the pressure from different groups or organizations or even individuals who wanted the governor to do more or less along the way. And again, I mentioned a minute ago sort of this inconsistency from him over the last few months about what his lines were, what his policies were, how best to encourage people to wear masks or get the vaccines. So, we wrote this article, I guess now coming up on a month ago, and the governor went on national television. He was doing a national television interview, and he was asked, why is Mississippi trailing most other states. We're talking, 48 other states at that point in getting shots in arms. And instead of sort of owning up to it and saying, here are the reasons why we're behind, he questioned the data. And he did a little bit of that in this interview again with y'all. I mean, he mentioned the federal agencies that are giving vaccines that we might not be counting all of or whatever. But I mean, I'll tell you, every single governor in every single state, whether they're ranked first place in getting shots in arms or last place, they're saying the same things. They're saying that there are reasons why the data isn't completely accurate. The real number is better than what's showing up in our database because of lags or federal agencies not reporting or whatever. So we're all in the same boat here. I would say it's all apples to apples at the end of the day. And the governor, once again, I thought it struck me that in that answer that he kind of, instead of owning sort of why we are behind, he kind of deflected again and questioned the numbers and, the racial disparities in particular, Byron, I thought were really interesting.
Of the 1.4 million doses of vaccines administered in the state, about 435,000 have gone to Black Mississippians. That's 32% of the total, and it's a big improvement from the first few weeks of the vaccination campaign. This tracks much closer to African Americans' share of the state's population. And the Kaiser Family Foundation found last week that Mississippi and the District of Columbia lead the nation in terms of vaccine acceptance among African Americans. There's more. It appears the bulk of current vaccinations are happening in more urban areas of the state, judging from doses administered by county. Rural counties tend to see relatively low numbers. So, Dr. Dobbs, what demographic challenges do you reasonably expect to face as you try to get hundreds of thousands of more doses into Mississippians?
Yeah, so rurality is always a challenge. There's just no doubt about it. And certainly we've been looking at that from day one, trying to make sure that we had partners in locations where rural folks lived. But even in rural folks, there aren't clinics. There aren't doctors necessarily. And so your infrastructure doesn't exist there as it is. So it is a challenge. There's just no doubt about it. I think we need to think about this in the totality of how do we go from where we've been to where we want to go as a healthy state. There's a lot in there. But I'd like to say, the rural counties are not necessarily doing that badly. Jefferson County has one of the highest immunization rates in the state, right? And it is a rural county. Bolivar County is doing great. A lot of our places are doing great, and a lot of that depends upon the successes we've had with our partnerships. We know that the two leading health disparities in our country are number one being African American and number two being rural. So we got a lot of challenges there. But this is a good springboard. We can use our successes and the things we've learned from this event to push us to the next phase for the other challenges we're going to have, whether it's chronic disease, diabetes, et cetera. So I think it's encouraging. I think our rural strategy has been mostly successful, but we're not satisfied. We got a long way to go, and we got some exciting ideas to take us there.
Adam, we're seeing what appears to be real improvements in vaccinations among Black Mississippians, but there's a long way to go, generally speaking, across the state. Your response to what Dr. Dobbs was saying?
Sure. Well, the first thing I'd say is sort of the historical or at least short history background here is that, of course, COVID itself, before we had the vaccines and as this virus was spreading rapidly, COVID itself was disproportionately affecting African Americans in Mississippi. That was by infections, percentage of infections rather across the state, and of deaths. And as we know, there are these healthcare disparities that have existed along racial lines in Mississippi, for decades, more than a century. I mean, you could go back even farther than that, I'm sure. Dr. Dobbs, I think, deserves a lot of credit. The Department of Health deserves a lot of credit for trying to make this a focus. So having that sort of historical understanding of this virus in the early days of the vaccine rollout, even though African Americans in Mississippi were disproportionately infected and killed by coronavirus, they were getting fewer vaccines, far fewer vaccines than white Mississippians. The number, I mean, y'all read this out, and it has definitely improved. I mean, Mississippi and the District of Columbia doing the best in terms of getting shots in arms of African Americans. It's a great figure. It's something that is certainly something to be applauded, but it took some time to get there. That's, again, credit to Dr. Dobbs and the Department of Health. But we had an article about this a couple of weeks ago. We kind of wanted to figure out why it was so bad starting out with and how we closed that gap here in Mississippi. And what we found was the Department of Health, Dr. Dobbs, listened to some of those community partners he talked about, those doctors in rural parts of the state, in predominantly black parts of the state where, there may have been some hesitancy about getting the vaccine in some pockets of the state, but it wasn't necessarily just because of a racial element. It was because, a lot of black Mississippians trust their doctor and their doctor only. So they didn't necessarily feel led to go out and get, trust the state at these drive-through state clinics or whatever. So something that Dr. Dobbs and the health department did was they listened to a lot of their community partners, a lot of those rural black doctors who were telling them in real time, hey, y'all need to change the way that you're distributing these vaccines because we're hearing from our patients who aren't going to get them unless we're giving them to them. So, again, credit to Dr. Dobbs and the Department of Health. They heard those concerns expressed by the partners that they sought out. And thanks to those community partners, the numbers look a lot better.
Good way of explaining how that was done. Thank you, Adam. And we'll have much more with Adam Ganucheau and our town hall review when Mississippi Insight continues after this break. We're talking with MississippiToday.org's Adam Ganucheau. And Adam, we want to try and lift the veil a bit on the governor's decision to lift the county targeted mask mandates. Many of our viewers had questions about that decision.
In early March, when I made the decision to take all mask mandates off on a county by county basis because the data suggested we should do so, we had just less than 600 cases per day on a rolling 7-day average. Since that time, in early March, when I made that decision, and I was roundly criticized from everyone from the President of the United States all the way down, but since that time, our total number of cases have fallen from just under 600 cases per day to over the weekend and yesterday we were below 200 cases per day. So another 60% decline over the last 6 weeks in total number of cases. Our hospitalizations, our patients in ICU beds have likewise plummeted.
The governor's absolutely right. I mean, we've continued to decline in our cases. There's just no doubt about it. And when we talked about it before, in the context where we were, the thing that was driving transmission was not people not wearing masks, it was social events. It was people having indoor things we're transmitting. So the real target really needed to be, and I think, for a variety of reasons, it's worked out quite nicely. The governor's had a very strategic approach to putting them on counties if cases get out of control, and when they backed out, pulled out, and he stuck to his word, and it seems to have worked out, quite nicely.
Was that something you agreed with? Were you in support of that decision, or were you not a supporter of that decision?
Yeah, no, I'm in support of people wearing masks, and I think one of the things that was important is the strategy. And I know our discussions were very often is how do you get people to do it the best? And if you belabor people over and over again and say this is never going to come off, that maybe that's too much, and then people are not going to respond to it properly.
The governor and Dr. Dobbs seemingly on the same page regarding mask mandates. What did you note from that exchange?
I guess the first thing is, that he talked about some of the criticism he got, I guess, in early March when he decided to do away with any mandate at all, whether it was, gathering restrictions indoors or outdoors or mask mandates by county level or whatever. Some of that criticism, I think, is built up over time. It's not just from people who lean left politically. It's not just from Democrats. He specifically, of course, mentioned the comments made by Democratic President Joe Biden, but his policies, his mandates over the last few months have been roundly criticized by really everyone. We've done a lot of reporting about how the most conservative Mississippians have criticized him, the most liberal Mississippians have criticized him. People in the middle, he's gotten criticism all along the way. And I think that, a lot of the criticism that we've seen about Governor Reeves, certainly in this most recent decision in March to just kind of do away with all of these mandates is, born maybe out of a lack of consistency. He's depending on the peak, depending on what was happening politically, he's made different decisions at different times. And I think people, even if they may agree with the decision he made to go ahead and do away with these restrictions as of now, they even felt a little bit burned by him from the past decisions over the last several months. In terms of sort of, what Dobbs said, I thought, again, I mentioned at the very beginning of this interview, just talking about this clashing of ideals between what Dr. Dobbs and health experts have said all along versus what Tate Reeves has done and said all along. On this one, I was glad to hear that Dr. Dobbs seemed to agree with Governor Reeves' approach, but I think he may have been a little gracious there. I think that Dr. Dobbs has very visibly and at times verbally been frustrated with some of the decisions that the governor has made over the last few months. And it's certainly great. Nobody would ever complain about the cases and deaths being so low right now. But, that's a trend. We're at the bottom of the tail end of this last curve, if you will. And health experts nationally are saying that there's another one coming if we don't continue to wear masks, if we don't continue to socially distance or get vaccinated.
All right, well, after the break, the Mississippi, the FMAP, and the access to Medicaid. The governor's resist expansion efforts. Will examine his rationale when Mississippi Insight continues after this. And welcome back. Governor Tate Reeves has doubled down on his resistance to Medicaid expansion efforts in Mississippi. Some of our viewers sent questions about that reluctance given the huge federal incentives to expand Medicaid access. Take a listen. Medicaid already serves about 670,000 Mississippi's poorest, most disadvantaged citizens, and state government already gets a huge amount of support from Medicaid. Mississippi currently gets the highest federal match for Medicaid spending or FMAP in the nation. The national average is 56%, but for the Magnolia State, the current rate is 84.5%. For every $5 the state pays for Medicaid coverage, the federal government reimburses the state about $4.22. And with the passage of the American Rescue Plan, that FMAP would be raised by about 5%. Our state would get an additional $600 million in federal incentives or over 2 years if we expand Medicaid coverage. As many as 300,000 more Mississippians could finally get health insurance. So, Governor, do you still think that's an unreasonable deal?
I still believe that when you look at the overall impact to Mississippi, I'm planning to be here longer than just the next 2 years. There's no doubt that the American Rescue Plan, which, by the way, only spent about 10% of the total money of the $1.9 trillion that the federal government spent on actual COVID-related expenditures, but of the entire $2 trillion, about 10% went to COVID-related expenditures, and everything else went to a very liberal left-wing wish list that the Biden administration had asked for. When you look at the incentives for those 13 or 14 states that have not expanded Medicaid yet in our state, they definitely provide incentives in the short run. But what happens in year 3? Or what happens in year 5? Or what happens 10 years from now when it's costing the taxpayers of Mississippi hundreds and hundreds and hundreds of millions of dollars more to pay the state share, because none of this money is free. This money has to be paid for. It has to be paid for by state taxpayers. It's going to cost our taxpayers significant amounts of money, and I just don't think those working Mississippians that are doing everything they can to feed themselves and feed their families, that their taxes ought to have to go up to pay for Medicaid for others.
We turn again to Adam Ganucheau for his analysis. Adam, this is a topic that could wind up on the ballot courtesy of Initiative 76. Talk about that campaign and its prospects.
Sure. Yeah, I think, the COVID pandemic, I think, highlighted a lot of disparities. Again, talking about healthcare in Mississippi, long estimated 300,000 Mississippians would be covered. Somewhere, there are different estimates, but 300,000 seems to kind of be the average of those estimates. 300,000 Mississippians, those are mostly working, poor Mississippians, would be covered under Medicaid expansion if our state's leaders decided to do it. So that initiative process, I think, is really interesting. It's the first real policy movement in Mississippi since the launch of the Affordable Care Act under President Obama that Mississippi's had to have this conversation. So, I think that was brought on by the pandemic. I think the organizers of this ballot initiative process have said that they wanted to launch it because lawmakers haven't acted. They think that There are billions and billions of federal dollars just kind of sitting on the table because Mississippi's Republican leadership won't expand Medicaid, and that's not only harming those 300 or so thousand Mississippians who can't afford health care currently, but it's also hurting rural hospitals in particular. Half of Mississippi's rural hospitals are on the verge of bankruptcy or some sort of financial disaster because they can't afford to keep giving health care to uninsured Mississippians. And that's something that doesn't just affect healthcare. It affects economic development. It affects questions like, do our young people care to stay in small rural Mississippi because they may not be able to get the health care that they need or deserve because the hospital closes or the ER closes, or there aren't enough clinics around because doctors don't want to have to keep forking over money to pay for uninsured patients. So it's a big question. It's something that I think, again, the pandemic brought on, and now that we have this ballot initiative process, the game's on. I mean, they're going to start collecting signatures to put that issue on the ballot. I think it might be a little bit optimistic, but they think that it could be on the ballot by 2022. And it's something that in Mississippi, it will be the political issue in this state for at least the next 12 months, at least.
Adam Ganucheau, MississippiToday.org. Thank you for being with us. Always a pleasure talking with you.
Thanks so much, Byron.
And we'll be right back. Big thanks to Mississippi Today's Adam Ganucheau for joining us this week. We'll be back next weekend with more of the political and current affairs coverage that you demand. I'm Byron Brown. From all of us here at 12 News, make it a great weekend.